Here are 7 treatments that actually make tennis elbow pain worse. Number 1 is aggressive massage to the area. Now, light massage might actually be helpful, but if you dig in there aggressively, there's a big nerve called the radial nerve that passes right through there, and it is possible to aggravate the nerve, and now you'll have a nerve problem on top of tennis elbow issues. Number 2 is aggressively stretching the area. Sometimes people will be instructed to stretch their wrist this way, to stretch it out this way, this way, this way, in order to get the muscles of the forearm loosened up. And although there's good intention behind this, this could also aggravate the nerve that runs right through here, the radial nerve, especially when doing this type of stretch right here. Number 3 is resting for too long. Now, resting is appropriate if the elbow's very flared up, because doing anything is going to aggravate it more. Even if you're doing the right exercises or the proper treatment, if it's too irritated, resting likely is going to be the best choice. But if you rest too long, once the elbow pain has gone down and you're able to tolerate some exercise, then you need to begin to do the exercises that fix the root muscle imbalance. If you continue to rest, you're potentially going to get even weaker in the muscles that are already weak. Usually grip strengthening helps to resolve this issue. And if you're not working on your grip strength because you're resting, then you're only going to get weaker over time, and this elbow problem is potentially going to fester. Number 4 is wrist extension exercises. So this is where you're doing this type of exercise, usually with a weight or against a band. You're doing it with resistance, and the intent here is to work the muscles on this side of the elbow in order to get them stronger. The problem with exercising these muscles is that they're usually dominant in the muscle imbalance. They're the muscles that are too strong, and the grip muscles on this side are too weak. And so by strengthening these wrist extensor muscles, you're actually feeding into the problem and potentially making your tennis elbow problem worse. Number 5 is finger extension or finger opening exercises. The same muscles that move your wrists in this direction also help to open your fingers, and they attach to the elbow here. And you can feel it if you open your fingers like this, or if you move your wrist back in this direction, you'll feel the muscles moving in this area. Strengthening those muscles that open your fingers also feed into the problem that makes the elbow joint shift and creates a worse tennis elbow situation. Number 6, shoulder raise exercises. So that's where you're holding weights and you're picking them up like this, or maybe outwards, or some version in between. Any exercise like that where you're picking up your arm and holding it out, you're going to be putting a lot of tension and stress through the ligaments and tendons that are already injured in the area because of the tennis elbow problem. Now, I've seen some healthcare professionals tell their patients to do this exercise and kind of work through it, work through the pain, but it's not a good idea because you have injured ligaments and tendons right there. And if you add weight to it to hold it up, you're only tensioning those poor injured ligaments and tendons more. You're going to keep the problem there for longer. And treatment number 7 is cortisone injections. If it gets bad enough, some people will go to their doctor looking for pain relief. They'll take pain medication, over-the-counter pain medication, possibly even prescription strength pain medication. But what really makes things worse is when the doctor offers a cortisone injection. Now, 1 might be okay, maybe even 2, but if you have multiple cortisone injections, like 3, they'll limit you to 3 a year anyway. We know that cortisone, although it's an anti-inflammatory and pain reliever, it also breaks down connective tissue, which is what tendons and ligaments are made from. So if you get repeated cortisone injections for your tennis elbow, you're potentially decreasing the strength of the tendons and ligaments and making them even weaker, which is just going to keep the tennis elbow problem there for longer. You might get some short-term pain relief from the medication, but long-term, it decreases the stability of the joints and keeps the problem coming back over and over. Hey, if you're looking for more help with tennis elbow problems, check out the link below in the description for tennis elbow pain help. And if you thought this video was helpful, please give us a thumbs up, share this with somebody you think needs to see this, and don't forget to subscribe and turn on our notification bell so you don't miss out on any future videos. Thanks so much for watching. I'll see you in the next one. Bye-bye.